Do you stay on top of your medical checkups? Life gets busy and it's easy to forget to make those appointments. So DAP Health started a new campaign to ensure that we take control of our health. Joining us now to explain is the Director of Specialty Programs at DAP Health, Dr. Jason Halperin. Welcome, Doctor.
Oh, it's great to be here. Thank you so much.
Yes, an important topic. Dr. Halperin, this campaign says a checkup is a checkup. What does that mean?
So that's correct. You know, in life, we're checking so many things. We check our phone to see how many text messages we have. We check how many steps we're taking. But we really want to make sure our patients are also checking in on their health. It is essential as checking your phone.
That makes sense. That's a great comparison. Now, I know myself, I sometimes feel uneasy, maybe even afraid of health screenings. How can we feel more comfortable going to these appointments?
Absolutely. And you're not alone in feeling that way. Some of it is the unnecessary stigma that exists, but there's also concern or lack of information. Well, we're really trying to flip that script. We want to make sure that you and all of our patients feel incredibly comfortable coming in for preventative screenings, because prevention is key to providing optimal health.
Yeah, sometimes we're even scared about getting bad news, but we just have to face it. And we know that DAP Health serves Medi-Cal underserved patients. And why is it so important to see these patients regularly?
So you're exactly right. We take care of those along the spectrum, including those that are most underserved in our community. And if you look at the disparities in preventative health, you can link it directly to socioeconomic status. So the higher your income, the more likely you are to have received preventative health care. We need to change that. We need to ensure preventative health care is 100% accessible to everyone in our community. It is how we keep our community healthy.
Okay, so we get the point. We have to do these checkups. If someone were to take you up on that, show up at DAP Health for a screening, what does that look like? What's going to happen?
Yeah, so you're going to see one of our incredible providers, and we are going to have a conversation with you in terms of your age and your gender on what are the recommendations to keep you most healthy. And then we are going to provide all of those services. Of course, we're going to educate you if you have questions. We're going to do this as a team. We're always a team. But I want to make sure my patients know exactly what are the recommended screenings, and I want to guarantee access to them. There will be no cost. That is our commitment. And we will go through all of the recommended screenings. That is how we define our quality of care.
Like a full body exam, basically?
Yeah, so it's an exam. Will definitely be listening to your heart and your lungs, but it's also, if you're a woman, it might be a mammogram. If you need a colonoscopy because you're over the age of 45, we might do a stool test or recommend that procedure. Everyone should be screened for HIV and other STIs, so things of that nature. We want to make sure we are doing what's best for you as per the highest recommendations.
And hey, for free, you can't beat that. So if someone's watching today, hasn't had a checkup in a while, what's the one thing you would like them to remember, Doctor?
Yeah, I want folks to remember that we are a team, and we need to roll out that red carpet to ensure our patients come, and they should expect the highest quality of care from DAP or whoever is providing them primary care. And patients need to feel like we are providing everything recommended, and that is our commitment. This is how we ensure our patients receive the highest quality health care.
All right, such important information. Thank you so much for your time today, Dr. Halperin.
Thank you so much. I appreciate you.
You are not alone in this. DAP Health wants to help.